Dr. Wigmore, people are so concerned, and that's the number one concern I think we've heard over the past several years is that there will be fewer rooms in the new hospital. How could we do this? Well, there's a method here.
Yeah, there's a big method here, and it's also exciting, is that historically some of our patient floors in women's health or pediatrics don't tend to be up at capacity. We tend to have epidemics in children's viral illnesses when we have a crowded pediatrics room, but otherwise we're below capacity. With these new flex beds and all the rooms being designed exactly the same, like you said in your early comments, we can swell or contract into those areas and use those beds, and when we need them, rather than being empty like they are now in some of pediatrics or medical or surgical during downtimes. So these flex beds, it's been well thought out, and we're pretty confident that the bed allocation in our hospital will be adequate for even a population that changes here in Moose Jaw. So we're excited about it, and it usually involves nobody having to move out of their room once they go there. So if they develop a viral infection or a sickness and some form of infection, currently we have to transfer that patient to another bed in order to have an isolation room. Well, these rooms are all pretty well fixed up for that, and when you move someone out of a room to go to an isolation room, it takes quite a few hours of cleaning, just like in a motel room, and that bed remains vacant. You can't use it. If we don't have to transfer people out of that room, we don't have a vacant bed, and that is over the course of a year adds up to a lot of beds that we currently can't use due to transfers. Mm-hmm. So it's a really good methodology how this is unfolding.
And times have changed even already, and times continue to change with new modern technology and better medical care. Even now, sir, I mean, decades ago, if you got sick, well, you go stay in the hospital for a few days. But times have changed already. The goal is to treat people and get them back home.
And oddly enough, that's the goal of the patients, too.
Yeah.
They don't come into hospital to stay sick. They know they can feel better, get better at home. And like you've said, times have changed, and studies have shown that people get more independent quicker when they're in their own homes. And our home care services that have expanded enormously in the last decade have enabled that to happen. And so do the style of care that we provide in our hospitals has changed dramatically. And people are getting better faster and staying better longer.
The 9th annual 800 CHAB Family First Radiothon will do more to help the situation improve even more. As we look to buy the state-of-the-art equipment for our brand new state-of-the-art hospital, Dr. Wigmore, thank you so much for your time, sir. I know we'll see you at the Radiothon, and I'd just like to know if you've got anything else you'd like to add before I let you go, sir.
No, I think I'm all good to go. I appreciate the time and effort that CHAB puts into this. It's always a charitable donation to the hospital and the effort you guys put in. So thank you for that.
I'll give a little bit.